Bedfast ICD-10-CM codes for hypertension. Hypertension, Bedfast ICD-10-CM codes for hypertension. Hypertension, Bedfast is an ICD-10 code that refers to conditions in which a person cannot move from bed to a chair. The OASIS, assessing the ability of a patient to transfer from bed to a chair, questionnaire is used to assess the patient's ability to transfer from bed to a chair. This ICD-10 code measures a patient's ability to transfer, not his or her willingness or adherence. ICD-10. Hypertension is a disease that causes cardiac changes, and is classified under ICD-10 as a result. There are several complexities in ICD-10, but for hypertension, the codes are fairly straightforward. In ICD-9, the condition was coded as malignant or benign. In ICD-10, the diagnosis is given with a single code, I-10, and the disease is labeled as essential, primary, hypertension. The ICD-10 manual has a list of the most common diseases. For example, it lists I-11-9 for heart failure, and I-50.1 for hypertension. However, it does not list any documentation required for hypertensive cardiovascular disease. A patient must first have a medical diagnosis of hypertension before ICD-10 can assign a diagnosis of hypertension. If a patient has both diseases, it is important to document the diagnosis and the cause. The ICD-10 manual does not list the required documentation for hypertensive heart disease. If the patient has both conditions, they must be considered simultaneously. The patient should be diagnosed as a hypertensive neuropathic disease. Nevertheless, this code is not needed in ICD-10. In ICD-9, the condition was categorized as a benign condition. Unlike in ICD-10, patients who have both conditions should be given different ICD-10 codes. In ICD-10, hypertension is coded as a separate illness, if not for the patient's condition. The ICD-10 manual does not specifically list the codes for it. The patient's condition should be documented with a specific diagnosis. Moreover, the patient's symptoms should be clearly described. In this case, a Bedfast hypertension code is used for both primary and secondary hypertension. The ICD-10 manual does not list the required documentation for hypertension. In ICD-10, the two conditions should be considered separately, and the physician should document the basis for the diagnosis. If there are two symptoms, they should be coded as I-10. This ICD-10 code is the one you should use. You can also find the ICD-10 codes for all types of diseases by using the tables available on the Internet. Hypertension is the only condition with two ICD-10 codes, ICD-10-CM. This ICD code describes a condition in which a patient's blood pressure is high. The code for a Bedfast is ICD-10-CM. ICD-10-CM is a universal, computer-based code, and it can be used to code various conditions. It can help you organize your data and make it more efficient. ICD-9 codes. Functional quadriplegia and functional urinary incontinence were requested as ICD-9 codes. These codes were approved and became effective on October 1, 2008. The ICD-10-CM will now also include a code for hypertension. These codes will aid physicians in assessing patients' long-term care needs. The four types of quadriplegics are defined as neurologic, spinal, and functional. While there are differences between them, they are all classified in the same way. For hypertensive heart disease, the ICD-10-CM manual does not list the required documentation. In this case, it is also important to document the basis for a diagnosis. A doctor must document the condition and the reason for its diagnosis in the ICD-10-CM. This is the most accurate way to diagnose a hypertensive patient. If the code does not match, a specialist will not be able to code the condition. Functional quadriplegia, quadriplegics.